We're going to hear now from Terry Borneman, who's a city council member with Bellingham City Council, who's been a long-term advocate for many civil rights in the community.
Thanks, Lynn. Good afternoon, everyone. It's good to see so many people out here today willing to stand up for health care. Got to say, I'm a member of the City Council, but I'm not speaking for the City Council today. We haven't taken an official stance on the current health care debate, but we have passed a resolution in support of universal health care. You know, Wednesday night, I, like so many others, watched President Obama's speech on health care reform. And I got to ask you, if you watched it, did it get you fired up? Yeah. Did it get you ready to move? Yeah. Did it get you fired up? Yeah. Did it get you ready to move? Yeah. Well, it got me fired up, and I'm ready to fan the fire under our legislators to help give them the support they need to pass a health care reform bill, one with a strong public option, one that will ensure all of our citizens. Now, I truly believe that there can be no real health care reform without public option. I have always been a single-payer person and pushed from the beginning. I doubt we're going to get it in there, but we need to at least get that public option, because there can be no cost savings without a strong public option. We in municipal government have watched as health care premiums have risen year after year with no correlation to the standard inflation, pricing individuals and businesses out of coverage. It has forced us, like so many other employers, to ask for higher contributions from employees and forcing us to look at other ways to cut the budget to afford the increased premiums. For city government, healthcare cost is a major part of our budget concerns. We have a broken system, and it must be fixed, and it must be fixed now. And we cannot be sidetracked by the sham of Tea Party movements and other organizations fronted by the conservatives who are more concerned with destructive politics than the health of our citizens. You know, if it wasn't so tragic, I'd find this whole Tea Party movement humorous. I have to ask you, where was their righteous indignation when President Bush drove our economy to the brink of failure? Where were their voices when he took a budget surplus and turned it into the biggest deficits in history? How is it that they fail to mention that the extraordinary measures that federal, state, and local governments are forced to now to take are the direct results of failed policies of the Bush administration and the deregulation and free market policies the conservatives have been pushing since Ronald Reagan? You know, this group cheered as Bush pushed us into a war with Iraq and screamed at many of us who spoke up against the illegalities and the ethics of this war and warned of the huge cost in human lives and financial resources to our country. Shame. Yes, that's right, shame. This is a group that cheered the deregulation efforts of the Bush administration, the massive subsidies to the oil companies, and the tax cuts for the folks in the upper income brackets, and now they dare to say that we can't afford health care for our citizens. Yes, they jeered as we protested the intrusion into citizens' rights through the Patriot Act, and now they yell about the false claims of government intrusion into people's lives as it relates to health care reform. You know, it's amazing to hear some of these folks trying to shout down legislators at town meetings, to silence the discussion, or calling the president a liar during the address to Congress, when just a few short years ago these same folks were yelling, "America, love it or leave it," at any one of us who dared criticize Bush's policies. These grand patriots who were so vocal against anyone who dared to speak up against the Bush administration and their policies now use near terror tactics to try to intimidate and block public policy and real health care reform. But you know, folks, despite the attempts at the diversions. The reality is, our only way out of the mess is to rebuild, to retool, and reshape our economy into one that is sustainable. We have to invest in infrastructure, in new ideas, in education, and in health care for all of our citizens. We can't go back to business as usual. We need real reform and not cosmetic reform that only ends up subsidizing the insurance companies. We cannot allow those in the teabag business or Republicans hell-bent on bringing down President Obama, or even conservative Democrats who are more concerned with their campaigns than with the health of their constituents, to divert our eyes from the prize. Last week I talked with Rick Larson, and he said he needs more calls from us to counter the negative calls from the right, and to give him the support he needs to support a public option. Well, we need to make those calls over and over and over again to him and to the senators. We need to continue to work and continue to speak up and continue to push our legislators to stand up for us, to stand up for health care for our citizens, to stand up for real health care reform. So I have to ask you once again, my friends, are you fired up? Are you ready to go? Are you fired up? Are you ready to go? Then let's go out today and make some noise and make our voices heard. Thank you.